You may find yourself in the midst of an intimate moment, fully engaged and connected with your partner, when suddenly an unexpected situation arises. The penis loses its rigidity. This occurrence can lead to feelings of frustration and a significant hit to one's confidence. It's important to recognize that understanding the underlying causes of this situation is the crucial first step toward overcoming the problem. I am Dr. Lisa Cruz, a urologist, and today I aim to shed light on what really happens when this scenario unfolds during sexual activity. Several factors can interfere with the natural process of achieving and maintaining an erection. Issues such as stress, various health conditions, and even the side effects of certain medications can play a significant role. By identifying what lies behind this challenge, you can begin to explore effective ways to enhance your performance and prevent such occurrences from becoming a recurring issue. With clear and accessible information, you will be empowered to regain your peace of mind and positively transform your intimate experiences. Before we delve deeper into this topic, I encourage you to subscribe to the channel to ensure you don't miss out on valuable health and sexual education tips. If you find this subject relevant, please give us a thumbs up and share your thoughts in the comments. Indicate with a 1 if this topic resonated with you or a 0 if you have any questions. Your feedback is vital in helping us improve and provide even better content in the future. The human body operates as an intricately integrated system, relying on precise signals to function effectively. In the case of achieving an erection, these signals initiate with sensory stimuli, something that you see, hear, feel, or even smell. These stimuli engage the brain, which serves as a control center, sending orders for the body to prepare for sexual activity. When this process begins, the parasympathetic nervous system kicks into gear. This system is responsible for calming the body, reducing stress, relaxing muscles, and directing blood flow to specific areas, including the blood vessels of the penis. As these vessels dilate, blood flows efficiently, leading to the generation and maintenance of an erection. It's almost as if the body is a finely tuned machine, where each component must work in harmony for everything to function properly. However, if something disrupts this balance, such as a negative thought or a distraction in the environment, the process can falter. Consequently, in addition to appropriate stimuli, it is vital for the man to be relaxed and free from external distractions, allowing the body to respond naturally and effectively to these signals. Do you desire to revitalize your sexual life and strengthen the bond within your relationship? In the digital book, Rediscovering Intimacy: Healthy Sexuality After 60, you will find practical advice aimed at reigniting desire, overcoming obstacles, and fostering a deeper connection. Check the link in the first pinned comment to discover how making small changes can profoundly transform your love life. The nervous system functions like an electrical control center, linking the brain and the body to ensure everything operates in perfect synchrony during sexual activity. The parasympathetic system takes the lead during this time, coming into play when the body is in a relaxed state. It sends signals to release chemical substances that promote the dilation of blood vessels in the penis, allowing blood to flow in and fill the cavernous bodies, thus creating the erection. However, if the sympathetic system, which is responsible for alertness and stress, takes over, the opposite effect occurs. It constricts blood vessels, redirecting blood flow to other areas of the body, such as the muscles and heart, preparing for fight or flight responses. In moments of anxiety, worry, or even surprise, the sympathetic system can interfere, blocking the erection process. For instance, a man might find himself in an ideal environment for intimacy, yet an intrusive thought, such as a lingering financial concern, can activate this state of alertness. In such cases, the parasympathetic system loses its effectiveness, and the erection may falter. Therefore, being relaxed and situated in a safe environment is essential for the nervous system to function in favor of sexual performance rather than against it. Psychological stress can act as a significant saboteur of sexual performance. During intimate moments, the brain must remain focused on pleasurable stimuli. However, when negative thoughts or worries intrude, attention is diverted. This occurs because stress activates the sympathetic system, placing the body in a state of alertness that inhibits the parasympathetic system responsible for relaxation and achieving an erection. External factors can also trigger this blockage. An unexpected noise, such as a knock at the door, or an unwelcome memory, can activate emotional triggers that distract from the moment. For example, A man may unconsciously associate a past uncomfortable experience with an ex-partner, which can create tension and disrupt the erection process. Everyday problems, like overdue bills, family conflicts, or the grief of loss, can create an emotionally charged atmosphere. Even subtle reminders of these issues can directly influence one's ability to relax. A man may initially receive adequate sensory stimuli, but stress can quickly become an obstacle to maintaining performance. Therefore, mental health and the environment in which the act occurs are crucial in preventing stress from becoming a barrier during important moments. Chronic health conditions such as diabetes, erectile dysfunction (ED), and hypertension can directly compromise the mechanisms that support a healthy erection. In the case of diabetes, the issue often begins with damage to nerves and blood vessels due to uncontrolled high blood glucose levels. These elevated levels can harm the nerves responsible for transmitting signals from the brain to the penis. Additionally, they can cause blood vessels to harden, impeding blood flow and making it challenging to achieve and sustain an erection. Similarly, hypertension causes comparable damage. Elevated blood pressure can harden and narrow blood vessels over time, complicating blood flow to the penis and diminishing the efficiency of the erection process, even when the right stimuli are present. Moreover, medications used to control blood pressure, particularly diuretics, can reduce the erectile response. The combination of these conditions significantly increases the risk of erectile dysfunction, especially in men over the age of 50. It is crucial to manage these diseases effectively, as maintaining healthy blood glucose and blood pressure levels helps preserve the integrity of nerves and blood vessels, allowing the body to respond more favorably to sexual stimuli. Certain medications can also have a profound impact on the quality of an erection, even in the presence of appropriate stimuli. Medications used to treat hypertension, such as diuretics, serve to regulate blood pressure but can inadvertently reduce blood flow to the penis, making it difficult to achieve the necessary rigidity. Additionally, these medications can lower zinc levels in the body, which negatively affects testosterone production, a hormone vital for sexual desire. Psychiatric medications, including antidepressants, are also known to alter sexual function. While they work to regulate emotions by affecting brain chemistry, they can frequently block sexual stimuli, delaying or preventing an erection altogether. This situation can be especially frustrating for men already grappling with performance-related anxiety. Medications for prostate issues, such as 5-alpha reductase inhibitors, can also have an adverse impact, reducing testosterone levels and therefore sexual appetite while directly affecting the erectile response. In all these cases, it is essential to communicate with your healthcare provider to explore alternatives or adjustments to your medications. Proper follow-up can help strike a balance between effectively managing health conditions and maintaining a satisfying sexual quality of life. For men facing erectile difficulties, medications such as tadalafil, sildenafil, and others can be effective resources. These medications act as vasodilators, enhancing blood flow to the penis and facilitating the rigidity necessary for sexual activity. However, for these medications to be genuinely effective, it is crucial to use them correctly and under medical guidance. A common strategy for men looking to improve their sexual response continuously is the daily administration of low doses, such as 5 milligrams of tadalafil. This approach enables the body to maintain consistent levels of the medication in the bloodstream, promoting more reliable performance. On the other hand, sporadic use of the medication before sexual activity requires adequate time for the drug to reach its maximum effect. It is vital to avoid self-medication or independently increasing the dosage, as these practices can lead to dangerous side effects, including sudden drops in blood pressure and heart problems. Moreover, it is essential to remember that these medications only work effectively when there is sexual stimulation present. Thus, creating a relaxing environment that allows the body to respond naturally to the stimuli is crucial for optimal results. Self-medication and overdosing on erectile dysfunction medications can often cause more harm than good. The anxiety to achieve quick results can lead men to disregard medical advice, increasing the dosage on their own. This impulsive action can result in serious complications, as medications like tadalafil or sildenafil have a vasodilating effect that, in excessive amounts, can compromise circulation and lead to dangerously low blood pressure. Additionally, inappropriate use of these substances can mask more severe health issues, such as cardiovascular diseases that require immediate attention. There is also the risk of developing side effects, including headaches, dizziness, and nasal congestion. In the most extreme cases, serious cardiac complications can arise. Therefore, obtaining medical guidance is essential to determine the appropriate dosage tailored to each individual's needs and health status. Avoiding excess and adhering to prescribed recommendations are fundamental steps to ensure safety and efficacy in the use of these medications. Adjusting medications to treat erectile dysfunction is a critical process that should always be undertaken with medical supervision. Each individual reacts differently to medications, and factors such as age, weight, overall health, and the presence of comorbidities, like diabetes or hypertension, can significantly influence treatment outcomes. What proves effective for one person may not be suitable or safe for another. An initial standard dose, such as 5 mg of tadalafil, may suffice for some men, while others may require adjustments. Doctors can evaluate how a patient responds to medication and, if necessary, increase the dosage or recommend safe combinations of substances. This process ensures that patients achieve their desired effects without incurring risks. For men using other medications such as diuretics or antidepressants, medical supervision is equally crucial to avoid harmful interactions that can negatively impact health or sexual performance. Healthcare providers can suggest less impactful alternatives or adjust dosages and schedules, ensuring that treatment is personalized. This tailored approach not only enhances results but also minimizes the risk of side effects, ensuring comprehensive care for sexual health. Implementing specific lifestyle changes can also directly influence the quality of erections, and one often overlooked aspect is the quality of sleep. Poor sleep can interfere with testosterone production and hormonal balance, both of which are essential for sexual performance. Establishing a consistent sleep routine and prioritizing a tranquil environment for rest can yield significant improvements. Additionally, staying adequately hydrated is another vital factor. Dehydration can hinder blood circulation and energy levels, thereby impairing the body's response during sexual activities. Regularly drinking water supports the body's overall functionality. Incorporating relaxation techniques into your daily routine can also yield positive results. Methods such as diaphragmatic breathing or targeted stretching can alleviate muscle tension and activate the parasympathetic system, promoting a more favorable state of relaxation. Lastly, investing time in hobbies that bring joy and mental relief, such as music, reading, or gardening, can enhance emotional well-being. When the body and mind are in sync, sexual performance is likely to reflect this harmony, creating a solid foundation for a more satisfying and stable intimate life. Now that we have explored the various factors that can lead to the loss of penile rigidity during sexual activity, from emotional issues like stress to health conditions such as diabetes and hypertension, I invite you to reflect on which of these points resonates most with your life or the life of someone you know. Please share your experiences in the comments. This could prove invaluable for others facing similar challenges. If you appreciate the content, please click the like button. This gesture is vital in helping more men access this information and take steps to improve their sexual health. Explore our other videos on the channel for additional insights and tips regarding male sexuality and health. There is always something new that can make a difference. And if you haven't subscribed yet, now is the perfect opportunity to join our community and ensure you don't miss any upcoming content. Thank you for your time, and I look forward to seeing you in the next video.